The doctor tells the intern to call the next patient. The patient enters the room. The patient is greeted by the doctor. The doctor asks the patient to step on the scale. The doctor weighs the patient. The doctor checks the patient's height. The doctor asks the patient to lay on the bed. The doctor examines the patient and questions her. The patient explains to the doctor how she ended up at the hospital that morning. The doctor asks the patient further questions. The intern takes notes as the doctor examines the patient. The patient cautions the doctor that it is hurting. The doctor, after informing the patient that she has to perform a biopsy, then proceeds to prep the patient for the biopsy. The second intern questions the doctor about the procedures she is performing.
Your doctor will inject a local anesthetic to numb the skin and surface of the liver. Once the skin is numb, your doctor will make a small nick with a surgical blade. This is where the needle will be introduced. Your doctor will carefully advance the biopsy needle to the surface of the liver. Your doctor will then ask you to hold your breath while he or she advances the needle into the liver and obtains the tissue sample. As soon as the biopsy is obtained, you will be able to breathe normally. You may feel a momentary sensation in your right shoulder during or just after the biopsy. Some patients have pain that requires additional medication.
Sir, you want to go any bench across there?
Are we gonna?
Okay.
You do the assignment, Miss Post, based on the patient who went and looked at the last time.
Assignment?
Miss Post assignment here, see?
I'm not into that girl.
Oh, I think I have to come back.
When is you for?
For tomorrow.
Let's sit down on this bench and do it now. But I'm not rushing. What conclusion you came to for this question?
Well, I feel the patient have a deficiency in fructose 1,6-bisphosphatase. Well, fructose 1,6-bisphosphatase is the enzyme which catalyzes the reaction where fructose 1,6-bisphosphate is converted to fructose 6-phosphate. Well, a deficiency in that enzyme is caused by a mutation in the gene which codes for the enzyme, and it is hereditary. So, well, from here we can see that normal blood glucose levels are between 3.9 to 5.6 millimoles per liter, but her blood glucose levels was 3 millimoles per liter. So here we can see that, her blood glucose levels was very low, and this is termed as hypoglycemia. This would account for her feeling weak and faintish because,
Okay,
well,
that makes sense.
since she was deficient in the enzyme, gluconeogenesis will be inhibited, and therefore she will have she glucose levels low, so she have low energy. But this would have come about because all her glycogen stores would have already been used up, and well, there is no gluconeogenesis. If we look here now, we can see that her lactate levels supposed to be between 0.5 to 2.2 millimoles per liter. However, she had a high lactate level of 7.1 millimoles per liter. Well, lactate is the most significant gluconeogenic precursor for the process of gluconeogenesis.
Okay, yes.
And well, since they had no gluconeogenesis, her lactate levels would build up and it will become high. And her high lactate levels will also account for her high pH, for
Her
her
pH levels.
Yeah, for her blood being acidic. Because
Okay,
you
yeah,
see it
so-
right, 7.25, and it's supposed to be between 7.35 and 7.44.
So she get a case of lactic acidosis. then.
Right.
Okay.
Well, the patient also had seizures, and seizures could be caused by low the main food supply
For the brain.
So if there's no glucose, that means that the brain will not be getting sufficient food, and that could result in seizures.
Alright.
However, in the absence of glucose,
Normally the body will use ketone
right,
bodies.
ketone bodies would be the food supply for the brain. But if we look here, she have a ketone body level of 3.8 millimole per liter, and normal ketone body levels is 30 millimole per liter. So she had a great deficiency in total ketone
So
body.
as in this stage of starvation, her body would have used up the ketone bodies
Right.
to feed the brain and whatnot.
Right. So that accounts for the low ketone body levels.
Wait.
Wait for what?
Your explanation of her blood test results correct, but I believe the enzyme deficiency wrong.
What enzyme deficiency you think she has there?
I believe she have a deficiency in her glucose 6-phosphatase enzyme
Why are you saying that?
because it will account for the patient having an enlarged stomach.
But I was going to explain that, but you didn't give me a chance.
Because you're real stick. Gotta be on the
Sorry,
draw.
nah.
Okay. So here what I believe will happen. So the glucose 6-phosphatase enzyme normally will catalyze the hydrolysis of the phosphate group from the glucose 6-phosphate molecule and release inorganic phosphate and free glucose, which will now go through the normal processes now. But since the glucose 6-phosphate enzyme have a deficiency which is caused by a genetic mutation, we will have an accumulation of the glucose 6-phosphate molecule.
Okay.
Now this accumulation of the glucose 6-phosphate will initiate glycogen synthesis. Now, and this glucose 6-phosphate molecule will be converted by phosphoglucomutase to glucose 1-phosphate.
Okay.
Now, glucose 1-phosphate will then be activated by uridine triphosphate. And then you will get where one phosphate group from the uridine triphosphate is released, and you'll get UDP glucose. And then now this phosphate group, which is pyrophosphate, is hydrolyzed by pyrophosphatase to give 2 inorganic phosphate, which will give ATP to fuel the reaction. The glycogen synthesis, right? So glycogen synthase is the main enzyme in glycogen synthesis. But first, glycogen have to come into play and form the primer for glycogen synthase, which with the primer now is a 4-glucosyl residue. Right. So glycogen synthase is the main enzyme in glycogen synthesis, and Well, but first, glycogenin have to come into play first and form the primer, which is 4 glucose residues.
Okay.
And then, well, you know what? I don't keep time of preaching, so.
Alright. Forget I'm not here.
I'm so stressed out.
I feel it's best we wait till tomorrow when Miss Gertrude's assignment and we'll know who correct or right. Because you see, you and this